Listen up. The patient is presenting with tennis elbow cold compression therapy and cellulitis.
What's your diagnosis?
I think it could be cellulitis caused by an infection. The cold compression therapy might have been a mistaken attempt to reduce swelling.
I disagree. Tennis elbow is a common issue among tennis players, so the patient might have been involved in sports. It could just be an overuse injury.
I'm leaning towards tennis elbow as well. The cold compression therapy supports the idea of it being a sports-related injury.
I'm not entirely convinced.
What if it's something more serious like Dupuytren's contracture?
It can sometimes lead to skin infections like cellulitis.
Frank, you brilliant bastard. It's Dupuytren's contracture. And we need to act fast. All of you, prepare for total mesorectal excision. It's risky, but it's the only chance we have to save this patient's life. You called me in, Tracy?
Yes, Hawks. I heard you want to perform total mesorectal excision on the patient with Dupuytren's contracture.
That's correct. I know what I'm doing. I have years of experience.
Hawks, we need to be sure. Your track record shows a pattern of being wrong.
This time is different, Tracy. Trust me, I have a good feeling about this.
I trust your skills, but we can't risk it without a proper diagnosis. Let's take a step back and reevaluate.
Leslie, we have a problem. The patient is in critical condition after the total mesorectal excision.
Oh no, that's not good. What do we do now?
I don't know how to tell Hawks that we made a mistake. Total mesorectal excision was not the correct treatment for Dupuytren's contracture.
I understand your concern, but right now we need to focus on saving the patient. Hawks will understand he cares about the patients just like we do.
You're right. We need to prioritize the patient's well-being. Let's do everything we can to stabilize them.
What in the hell were you all thinking? You nearly killed our patient with your incompetence. Wrong total mesorectal excisionary and wrong diagnosis. Unbelievable.
I swear we thought we had the right diagnosis, Hawks. It wasn't intentional.
Maybe it was a miscommunication among us, but we did our best.
I still think our initial diagnosis was correct despite the outcome.
We can't be right all the time. Mistakes happen.
Mistakes. This was a colossal screw-up. You call yourselves diagnostic doctors. Pathetic. I don't have time for this incompetence. Figure it out and do better next time. So, Johnson, how's it going outside the hospital? Any exciting updates in your personal life?
Oh, just the usual stuff. Planning a weekend getaway with my family, trying to keep up with my hobbies. Everything okay?
I've been engrossed in this particular case we have. Something about it just doesn't add up. I can't seem to shake it off.
You never cease to amaze me with your dedication, Hawks. I admire that about you.
Wait a minute. I think I've got it. That's what's been missing.
Johnson! I have to go. I think I know exactly what's wrong with my patient.
Okay, sure. Good luck with that, Hawks. See you later, I guess.
Excitedly goodbye, Johnson. I can't believe I missed that crucial detail. Sorry I'm late. Had to deal with something urgent.
Hawks, where's your protective gear? You can't just barge in here like that.
It's unacceptable, Hawks. You should know better.
Listen, Dupuytren's contracture was misdiagnosed. It's Wildervanck syndrome.
Wildervanck syndrome? What's the prognosis for that?
Prognosis for Wildervanck syndrome is not favorable. Surgical intervention may be needed.
How certain are you about this diagnosis, Hawks?
I've reviewed the case thoroughly. Trust me, it's Wildervanck syndrome.
We need to prepare for surgery then. Let's get this patient prepped ASAP.
All right, let's move quickly. We have a new diagnosis to address.
Thanks, Tracy. It feels good to finally have clarity on the patient's condition.
You did a great job, Hawks. I'm proud of you for unraveling this medical mystery.
But if I didn't have to work with incompetent doctors, this whole mess could have been avoided.
Hold on, Hawks. You were the one who made the initial wrong diagnosis.
Well, maybe my team's diagnostic tools weren't up to par then.
No, you can't shift blame here. Take responsibility for your mistake.
Rumble's fine. I need some fresh air.